Sathyabama Institute of Science and Technology.
Hello all, this is Dr. Priya Kumari, Assistant Professor, Sathyabama Institute of Science and Technology, deemed to be University, Sathyabama College of Physiotherapy. Today in this episode, we are going to discuss about one of the emerging trend in the field of physiotherapy, that is virtual rehabilitation. And to discuss about that, we have an eminent person with us, Dr. Vishnu Priya, who is Assistant Professor in Sathyabama College of Physiotherapy, who will be sharing her knowledge and expertise in the field of virtual rehabilitation. So I welcome you, ma'am.
Thank you, Mom.
Thank you so much for giving your valuable time, and we would love to hear from you your experiences and knowledge about virtual rehabilitation.
Thank you, Mom. Thank you for your sound introduction.
Ma'am, we'd like to know what is VR, virtual rehabilitation, and what is its scope in physiotherapy?
Virtual reality is an advanced technique. It is a recent trend. Actually, it was there since early 90s and all.
Okay.
But recently, it has been now evolved much, and it is used in various fields like entertainment, gaming industry, and retail, and in medical, and also in education. So this is like a booming trend in all the other areas too. So we are in healthcare. It is like a boon for us. We can use virtual reality to educate our students, or to engage in diagnostics, or to utilize VR for our treatment strategies and all. So there are a lot more scope of VR in our healthcare practice.
Is it like giving therapy in the form of games or something? Like games are also there. Like general people, they understand it like therapy in the form of games.
Yeah, it is a sort of game.
Okay.
So there are different applications or softwares where you can give them a kind of a game or a task, or a real environment kind of thing also. So there are a lot of varieties in that. Actually speaking, you have two types in VR. One is immersive and other one is non-immersive. So immersive, you will immerse the patient or the person or the user fully into the environment, and
Okay.
they can see the environment, they can virtually feel the environment, and they can interact with the environment. And the other type is like a non-immersive type, where the person or the user cannot really interact, or they cannot feel that they are really immersed inside. So these are the two different extremes of VR. So I feel the immersive type is one which we can use it for our education purpose, and for our therapeutic purpose, and for knowledge sharing, or for training students, and for training other healthcare professionals too.
So, ma'am, recently I had an experience in our Sathyabama College of Physiotherapy OPD, where I had used this Oculus device, and it was amazing to see different, in getting engaged in a different world, a different environment. So, is it like if we engage the patients in that using Oculus device, if we treat them, they will be benefited more, and it will be motivating for them? How you feel according to your experience?
Say for example, if we are getting a stroke patient, or any patient with a orthopedic issue, or those who have range of motion restriction, or any kind of physical limitation, we as physiotherapists, we will be treating them for many sessions. Like say
Correct.
for example, we'll be treating them nearly for stroke patients, means we'll obviously treat them for a month or 2 months or a 6 month. So it is really tiring for the patient, and also for the therapist to do the same sort of set of exercises or same routine, and the adherence to exercise and adherence to the therapy session is restricted. So the patient will also feel bored to come to the OPD or to come to the hospital for every visit and do the same kind of exercises. So in VR, we can really engage them for about 20 minutes or 30 minutes. So in that way, they'll be continuously engaged and they will be able to interact with the environment, and also they will get motivated. So it's completely a reward cycle. Say for example, we are using Instagram or Facebook or some sort of social media. We generally used to scroll more and more, and it also encourages us to do it more and more, right? So similar way, a child is using mobile or a game or some YouTube videos. So the child wants to do it more and more. Because there is some sort of reward which is happening in the child's brain. So there is some chemical changes which will obviously happen. There are different chemical transmitters that will be produced in the child's brain, like dopamine or serotonin. So these are the mood boosters or some sort of mood enhancing chemicals. So whenever the child uses the mobile or whenever we scroll Instagram, we will be getting lot of rush of dopamine in the brain, and obviously there will be a certain level of increase in our blood dopamine. So this dopamine is going to create some sort of happy mood or happy feeling.
So that's a reward they're getting for playing like a game form if they do the exercise, right?
So the same concept we can apply over here to the patients also. Whenever they enter into an unrealistic environment, they also feel motivated and they also feel engaged for some period of time. So in that case, it further stimulates the production of dopamine. Obviously, it is going to enhance their mood and enhance their performance, and there is a cycle. So there will be a release of dopamine and there will be an enhanced mood, and this is going to be a reward cycle. So this cycle keeps on continuing whenever the person is immersed or whenever the person is engaged in some sort of activities. And also, ma'am, I would like to add one point here. There are certain neurons in our brain called as mirror neurons. These neurons are especially present in the areas of frontal or generally in the cortex, cerebral cortex, and also especially in the hippocampus. These are like the imitating neurons. So whenever you do task or whenever you see some person doing a task, you will also imitate it, right? Say for example, you are yawning. If I see that, I'll also get the same task, right?
Yes, yes.
So this is an action which is done by the mirror neurons. Say for example, if the patient is observing somebody's movement, their mirror neurons get activated and they'll also get that motivation to do it, or the motor neurons which are responsible for that activity will be firing that time. So in this VR, we can really stimulate those mirror neurons, and like we are giving them the real scenario, right? And also we are demonstrating that how to do a task. So in that case, obviously their mirror neurons are going to get stimulated and we can enhance their performance that way.
Really great. So mirror neurons, play a vital role and they're getting activated.
Yes.
So like how easy it is to convince the patients, because it's an emerging trend, right? So how easy it is like to give them expose them to new trend of physiotherapy? Or is it difficult? Do you find it difficult?
No, not at all. Actually, in the beginning, patient would feel like something is new, or they feel like it is like they lose their balance or fear of fall would be there. But obviously, after a few trial, they are able to overcome that fear and they are able to gain the confidence and they feel motivated to do the task. For example, when we start using the mobile phone, we are not convinced by anybody, right? So we are using it by our own. We are learning it by our own, right? So similar kind of thing happens when we expose them or when we are exposed to certain technology. We obviously learn it very quickly. Like our brain is designed that way. We really learn it quickly. But as far as patient is concerned, they find a little difficulty in the beginning. But when you keep giving them continuous monitoring, or when you continuously give them instructions, or when you give them proper boundary, or when you give them proper set of regimen, they'll be really motivated to do it, because it is again going to enhance their reward cycle.
And since it is in the gaming form and different technology, they will
Correct.
be more engaged,
Correct.
right?
Correct.
Okay, that's really great, I think, for the patient's recovery.
And coming to VR tools, there are a lot many tools available in the market, right? See, it is not a new trend actually. It was there from 1990s,
Yes, yes.
1980s. Since then, it was started. But now it is recently emerging, and it is like a booming trend everywhere in the market.
So it's evidence-based already. We have evidences, right?
No,
For
evidences are not much
Okay.
for the healthcare. It is
Okay.
actually evolving now.
Okay.
Yes. So there are a lot many tools available in the market, and we have to choose them wisely. And there are a lot of platforms which provide you free gaming engines. There are so many tools available which is free of cost,
Okay.
that we have to explore more, and we have to try it on our own risk. Actually, this is going to be like a trial and error, and we have to do lot of clinical trials so that we can prove and create evidence.
Yeah, that's we think we have to keep in mind. So, what
Correct.
would you advise to our students that if they want to start their VR based rehabilitation center, what ethical things they should keep in mind? Is there any ethical considerations we
Correct.
have to be particular about?
Right. So for any treatment or for any intervention or any protocol which is new, definitely it has to be validated, and it has to run through that process of ethical, right? So we need to consider lot many things before putting it over the patient. We have to see in all the domains, we have to consider all the issues, like if you are putting the patient in a complete immersion, we need to really screen them for many things like visual impairments, or their balance and their fear of fall, and what if the patient is having vertigo, and all the other things we actually need to consider before putting them in the immersion.
So, what I really wondering how this, suppose if there is a visual impairment for some patients, so how VR is going to be given to them, or is it still researches are going on? It has to be explored.
Yes, it has to be explored more. For certain population, those who have limited visual impairment, or those who have low visual acuity, within the range we can definitely consider them for our treatment.
Okay.
But those who are severely impaired, for them I think definitely there has to be some other new innovation, like we can give them haptics, or we can give them more of auditory inputs, or
Okay.
some sort of other sensory inputs we can give them.
So it can be future scope for our
Definitely,
students.
definitely, ma'am.
Okay, ma'am. At last, what is your take-home message for our students and physiotherapy professionals? What would you like to advise?
So for students, I would like to say there are a lot of challenges when you pass out and come. So the field is really competitive. Actually, it is very tough outside when you see. Getting a job is really not an easy task nowadays, and you have to have that thrive for success. Only
Yes.
when you shine, then the people will come to you actually. So that is one message I would like to give. You have to have that thrive for success. And for our fellow professionals, I would always say that we need to be updated, and also follow some evidence-based practices, because it is always critical, and it is always necessary actually in our field, because we always need to be updated, and we need to critically analyze things, and logically reason out, and take the decisions, clinical decisions wisely, ma'am.
Well said, ma'am. That we need to thrive for success for the students And for the fellow professionals, they have to keep on researching, keep on updating themselves so that we can give more and more information and innovation ideas and the researches going around to the students so that they can raise the standards for our profession. Thank you so much, ma'am, for giving such a valuable information and giving a valuable time to us. Thank you. So, according to ma'am's talk, what I can conclude is for the students, she has given a very informative message that you have to thrive for success. And for fellow physiotherapists, we have to keep on looking for the evidence-based practice, research, and keep on updating our skills so that we can produce more and more students, skilled students, which will be of help to the patients, to the community, and to the society. So for further such informative episodes, keep watching Physio Beats Podcast, where we'll be discussing about different emerging trends. Stay fit, stay progressing. Thank you.